Good afternoon. I'm actually here with Pam Bradshaw. She's our Chief Operating Officer. She also is a nurse, and so we're going to talk a little bit about nursing today. And how long have you been a nurse?
I have been a nurse for 29 years.
29 years.
Long time.
Tell me what you love about nursing.
You know, I think what I love the most about nursing is that you can do so many different things. We always think about you work in a hospital and you work at the bedside taking care of patients, but the reality is you can work anywhere. You can work in a provider's office, you can work in your home, in many different types of settings. You can even go to the patient's home. And I think that's what I like the most, is that flexibility.
I think nursing is just a great profession for many people to go into, but it doesn't seem like there's enough supply of nursing professionals out there to fill the demand, not only of Shannon, but many other organizations in around the state of Texas, as well as the nation.
I think a few things have changed over the past few years. 10 years ago, patients that were in our ICU needing care are now being cared for on med-surg. So the patients are a lot sicker now than they were years ago. So they're staying in the hospital and we still have to get them out as quickly as possible, but they're just sick. And then when you add to that, being a nurse is hard work. You know, you work 12-hour shifts, you're on your feet most of that. So I think one of the things that we're doing as a country is really recognizing how important nursing is for our future. As our baby boomers continue to age, there's going to be a greater and greater need for nurses. We have to have people that can take care of those that are aging. And unfortunately, there's more baby boomers than we have nurses coming up. So we work very closely here in San Angelo with both Howard College and Angelo State University. All of their nursing students do clinicals here at Shannon, and I think that that allows us to be able to really help pick nurses that would be a great fit for Shannon and provide great care for our patients.
Well, I'm actually here with Nikki. Nikki is a case management nurse, so tell us a little bit about what a case management nurse does.
So case management nurses in the hospital, we look at patients from the time they arrive in the hospital all the way through discharge. So we work with the whole team. We work with therapists, with physicians, heavily with social workers, dietitians, and lots of outside agencies. So what we're really looking at is that we have a good, safe discharge for our patients, and that we work with the patients and families so that they're successful in their discharge.
Can you go right into case management right out of school, at nursing school, or how does that work?
No. So we ask for 5 years as a registered nurse. You really need that good grasp on your nursing care and your bedside care so that you can understand putting all those puzzle pieces together, because often it is a puzzle, often it's really complicated situations. And I've done this for 14 years, been at Shannon for 26, and I learn something new every day. And every week we have situations that we've never come across before, so you're constantly putting all those pieces together to try to figure out what's best for our patients.
I'm actually on the 3rd floor. I'm in the OR, and I'm actually here with Edith, who's a nurse here in the OR. So tell us a little bit about your background. How long have you been up here in the OR?
I've been at the OR for about 4 years
4
now.
years?
I went to Angelo State
Okay.
and graduated from there. I used to work in the 4th floor, then transferred whenever I got my RN to the OR. It just intrigued me. It's a different kind of nursing. A lot of it you learn on the job, and you just have to be very familiar with stuff.
So tell us, what do you like about the OR? Is it?
The OR is a different kind of nursing. We do a lot of patient advocate. Once our patients are asleep, pretty much they depend on us to be able to look out for them. So you have to be very familiar with their history, their medications, and all of that in order to take care of them while they're under, because surgeons and anesthesiologists alike depend on you to know that kind of stuff.
I've always been amazed or pretty much intimidated when I come up to an OR room about all this equipment and how to use it. So how do you guys get trained on that?
It gets intimidating at first. It takes time, of course, with anything to get familiar. Once you learn it, we use it on the daily, so we become very familiar with it. We have in-services whenever we bring new equipment in, so everybody gets to learn how to work the system before it actually becomes in contact with the patients. Our nurses are cross-trained, which means they can do anything from general to vascular, orthopedics, ENT, plastics, dental. So we vary a lot. You can put us anywhere. It's never the same, and like your day is never the same.
Jake actually makes me look pretty short. But he is the nurse manager for 6 North. We're actually in one of our new sections of the tower that we just opened up. And tell us a little bit about this unit and the type of patients that you have on this unit.
Primarily, we have your medical surgical patients, so more the medical side, so your pneumonias, your COPD, some of that stuff. We're 45 beds with the new addition of the tower. We do a little bit of everything. We see probably the widest variety of patients out of the hospital, with the exception of 5 North, which is the same as us.
I've always thought being a nurse manager is one of the most difficult jobs within a hospital. Is it pretty challenging?
It has been a big challenge. One of the bigger things that I've had to work on with me was just the people leadership, trying to learn that skill. And then the 24-hour run, I mean, you're kind of on call all the time. If something happens, I got to come up here. But fortunately, we have a team up here that has been easy to work with.
I'm assuming even when you come out of school, you just don't automatically come up here and you put them to work. What type of training do they go through before you kind of release them to the wild, so to speak?
So they do 1 week of the normal hospital orientation, and they get their training with Epic. Once they're actually on the floor, we do about 10 weeks of orientation where they will shadow and follow a nurse, starting taking 1 patient up to the 5 over the course of the 10 weeks, where they can start to learn how to think like a nurse and the process of how, time management and all of those skills that a lot of school stuff doesn't teach you, just the on-the-job stuff. And we have built a really fun team up here, and then the other nurse managers, I have really enjoyed my transition up here as far as getting to work with all those people. Some of people's worst moments, getting to say, hey, I've got you, you're okay. And them kind of releasing some trust and building that relationship, not just one patient, but multiple times, was probably the most rewarding thing I've done.
I'm actually here with Anna Pittman. Anna Pittman is the Chief Operating Officer for our Shannon Clinic, our practice plan. When it comes to being Chief Operating Officer as well as Chief Nursing Officer within that clinic setting, what do you love about your job?
I'm very passionate about patient care, obviously as a nurse, but working with others, nursing staff, different departments, physicians, advanced practice professionals, and helping solve workflow issues and just making sure that we are doing everything we can in the clinic setting to take care of the patient the best way we can.
One of the biggest struggles that you have today around being Chief Operating Officer is around staffing.
I will say, because of the way we operate in the clinic, which is different than in the hospital setting, we do have licensed nurses, but we also have medical assistants, certified medical assistants, registered medical assistants that help us day in and day out make sure that our patients are cared for.
Tell me a little bit about what the MAs do. Kind of how do you use them within a department?
It's a great question. Medical assistants typically are the individuals that are calling patients from the waiting room by name and putting them in an exam room, collecting vital signs, temperature, blood pressure, those types of things in order to tee up the patient for the provider or the nursing staff.
I'm actually here with Kayla. She's an RN. And tell us about where we're at right now.
We are in the OB-GYN department on the 2nd floor of the Harris Shannon Clinic building. It's my heart. I love it. And just being able to talk to patients all day long and encourage them throughout their journey from pregnancy, the first part, to the delivery, then the postpartum, and then coming back and, oh, I'm ready for a hysterectomy. And just, it's the whole, you go from like the very beginning all the way to like delivery, and then they bring their babies back with them. And it's fun.
When you're in the hospital, a lot of times you see them one time. And,
Yes.
And you get to bond with them, but it's for a short period of time. But over here, they're kind of
You see them
patient for
a
life.
long time.
So that is, I would think that's pretty neat. There's a lot of different opportunities for nursing
Yes.
in very diverse areas within both the hospital setting and the clinic setting. Now this building's pretty new. How do you like it so far?
I love it. I love it. It's beautiful. All the rooms are all decorated. You can tell, when you go to different clinics and stuff, that this one was decorated by each individual doctor. So they each have their taste. Well, whenever you see patients for the last time, like after seeing them, weekly for months, then you see them for the last time before they go over to the hospital to be delivered or induced, and they cry, and then I start crying because they're gonna miss us. And then they'll come back and visit, and just pop on, oh, we were driving by, and we'll pop in and say hi, and they'll bring their baby and, just hug us. And it's just because you develop that relationship.
Well, it's a really beautiful day out here. We're in the Hope Garden, and I'm actually in the oncology location here at Shannon. I'm here with Kristen, who's our nurse leader here in oncology. So tell us a little bit about where we're at, the Hope Garden, why it's here. And
we're at the Shannon Clinic Magdalene on Magdalene Street, and we're on the first floor. The first floor predominantly has oncologic services, so we have radiation oncology and then medical and hematology over here as well. And so this garden was actually donated. The plans and the funds and all that to get it going was actually donated to us. And this is what you see here. Patients can come out here during their treatment, or if they just want to, take some time away from everything, they can just come out here and relax in this soothing environment.
for you and your team, a lot of the patients that come to you guys, y'all have them, they stay with you for a while.
They do, and that's, somewhat unfortunate because they come to us under uncertain circumstances where they have cancer, that kind of thing. And so, we start their treatment and it can be as little as once a week for a month to, sometimes it's 12 weeks long. And then after that, there's a certain time frame after that. So we get to know them quite a bit, which is a good thing for us. And for them, they have some continuity of care and they know what to expect once they come in the door. And so I think it's something they appreciate in the long run. I enjoy it.
What type of training do I need to go through before I become an oncology nurse?
Well, typically I would like the nurses to have a minimum of 2 years experience. Of course, we don't do LVNs, unfortunately, because you do need to have the comprehensive assessment skills that an RN would have. And you just learn that in school and then with years of practice. And so 2 years is what I really like to have as a minimum. Nurses can go anywhere, and that's the greatest thing about the profession, but it's where do you want to be? I can go anywhere, but where do I want to be? And Shannon is a good place to call home because, like you said, there are so many different areas that you can end up in, but it's just all specialized.
Well, I so appreciate your time, and I appreciate everything you do for Shannon, and most importantly, I appreciate everything you do for our patients and their families. Nursing is such an important part of things that we do, everything that we do here at Shannon. As I mentioned earlier, their biggest, when you look at our staffing, nursing makes up the biggest component, and they have probably the most patient interaction day in, day out. So appreciate all that our nursing professionals do for us each and every day. So thank you for your time.
Thank you.